Good morning, good afternoon, good evening, depending on where in the world you are joining us from, and a very warm welcome to this virtual event. My name is Mercy Juma from BBC Africa, coming to you live from Nairobi, Kenya, and I will be moderating today's event, the second edition of the Lives in the Balance Summit, co-hosted by the Partnership for Maternal, Newborn and Child Health, Universal Health Coverage 2030, Co-Group, and other partners. Now, a huge thank you to all of you for being here today. More than 1,600 participants joining us from 110 countries, from Colombia to Ghana, India, South Africa, Malaysia, Australia, and many other countries. It is so good to see all of you here. And it is a great pleasure to have participants from government, civil society, and the health workforce. And also, we have youth leaders and community representatives joining us today. This indeed promises to be a very fulfilling event. Now, this is a live event and we are live on chat with a group of colleagues. So feel free to share your thoughts, stories, and questions with us and let us know where you're joining us from on the chat. If you're from Ghana, say hi from Ghana and all that. And we are also keeping this conversation alive on social media. The hashtags we are using are hashtag Lives in the Balance, hashtag UHC for Universal Health Coverage, hashtag COVID Call to Action, and hashtag Health for All. And we look forward to hearing from you on Twitter, Facebook, Instagram, and all other social media platforms. Now, we promise a very engaging, very interactive event with a brilliant list of speakers coming up. And your voice as a participant is, deeply treasured and deeply valued by us. Throughout the program, we will have poll questions put up on the website. Please do send us your responses. And to start us off, here's our first poll questions, and we're asking you, what percentage of people worldwide still do have access to full coverage of essential health services? The poll will come below, somewhere down here. Please let us know what percentage of people worldwide still do have access to full coverage of essential health services. And as you do that, let's do a bit of housekeeping. Now, this meeting is being translated into French and Spanish, and you can choose your preferred language via the options on your screen. There's also sign language interpretation, which will be available throughout the program. Now, the Lives in the Balance 2 website is also available for you to consult, and therein we have the online agenda, the speaker list, media contacts, and a great set of resources, including key reports relating to women's, children, and adolescents' health, universal health coverage, and COVID-19. And just a friendly reminder to all of us to refer to the events code of conduct available on the website to ensure that we respect each other and, we ensure an inclusive way of communicating with each other and participating for us during this 3-hour event. Now, when we met in July for the first Lives in the Balance Summit, we heard from you about your experiences, challenges, and needs during the COVID-19 pandemic. You called for urgent action by governments and all stakeholders to ensure the health and well-being of women, children, and adolescents during COVID-19. And these were highlighted in the 7 advocacy asks from the PMNCH call to action. Now, today, on the eve of Universal Health Coverage Day, and a little over a year after world leaders endorsed Health Coverage Day and endorsed the political declaration on universal health coverage, the interdependency of universal health coverage, UHC, global health security, and the health and well-being of women, children, and adolescents has never been clearer. And in today's discussions, we will reflect on the progress we've made, share lessons, and collaborate and act to ensure that we build back better and generate systems that support and protect everyone. And this is the theme for this year's UHC Day, investing in systems that protect us all. But before we start, let's watch a very special video that highlights for us some of the key messages from the July Summit.
People suffering, everywhere. Our communities, doctors and nurses.
Greetings to all.
Greetings from Mexico City.
Calling in from Malaysia.
Bangalore in India.
Nairobi, Kenya.
Can make a difference.
Women should absolutely be at the center of the COVID-19 response.
We are not leaders of tomorrow. We are leaders of today.
We cannot afford to pretend that we are making inclusive policies without bringing young people to the table.
Let us make our ourselves ready. COVID ready.
Come and join us, and we look forward to reflect and collaborate.
I strongly believe we can strengthen our voices on women, children, and adolescents' health.
Starting from households, communities, and other sectors, we are in this together.
Our partnership has come together with a call for action, a 7-part one.
To leave no women, children, or adolescents behind our response to this pandemic.
Living like this, the choice that you make now can decide the future. The things that you do now can make a difference.
We're just excited to have this global conversation.
Everything was amazing, trust me.
I have a right to quality services.
Living like this, yes we can. Together, one world, we will succeed and overcome. To all the doctors and all the nurses, saying thank you, we will never forget you. We will never forget the doctors and all the nurses, saying thank you, we will never forget you. We will never forget COVID-19, it is real, but we are realer, and we are stronger, and we will conquer.
Thank you very much and welcome back, everyone. And, those were just highlights of the July summit that we had, and just reminding you that everything that happened on 1st and 2nd of July when we had that summit is still online, and Lives in the Balance website is still up, and you can always go back and refer to that in case you missed it. And also this one will be recorded and everything will be online and available to you even after these 3 hours are over. And that video just demonstrates the importance of coming together to reflect and share on how we can do better by the health of our populations. Now, before I hand over to our first speaker, let's bring your attention back to the polling question we asked earlier. And we asked you, what percentage of people worldwide still do have access to full coverage of essential health services? And while we wait for others to fill out the poll, if you want to find out more about UHC and learn about the impact of COVID-19 on women's, children, and adolescents' health, you can click on the resources section of the website, and there you'll find a variety of items that you can consume, a variety of resources such as the PMNCH digital toolkits, which are launching today and showcase up-to-date and trustworthy resources to help inform you on key topics such as immunization, pregnancy and childbirth, and adolescent health and well-being during COVID-19. And now back to the poll question we asked, what percentage of people worldwide still do have access to full coverage of essential health services? And let's see what you say. So the correct answer is C, 50%. I don't know if you all got that right, but yes. UHC, first of all, means that all individuals and communities receive the health services they need without suffering financial hardship. But WHO data shows that at least half of the world's population, that is 1 in every 2 people, still do not have full coverage of essential health services. And even before COVID-19, about 100 million people were pushed into extreme poverty each year because of out-of-pocket spending on health. And we're seeing it everywhere. You see, in Kenya, as journalists, we see it every day. People are selling their land, the livestock that they depend on for food. People are using up all their savings to pay for healthcare. Every other day, we cover stories of people who have been detained in hospital for years, families who have been denied to take home their dead and bury them because they cannot afford to raise money required to pay hospital bills. And we have been facing serious challenges in attaining UHC even before COVID-19. And now COVID is here. And what it is doing is it is just widening inequities and putting the most vulnerable further at risk. Now, on this critical note, I want to introduce our first speaker. He is an inspiring leader who has advocated for and worked to ensure that health systems respond to the needs of all. Dr. Gethenji Gitahi, Chief Executive Officer of Amref Health Africa and the co-chair of UHC 2030. Welcome, Dr. Gethenji.
Thank you so much, Mase. And it's an honor for me to be here to introduce a video which presents key findings from the UHC 2030 recent review of the state of commitment to universal health coverage. Last year, as you will know, in September, global leaders met at the UN high-level meeting on universal health coverage on moving together to build a healthier world in an atmosphere of optimism and ambition that had rarely been witnessed before. Indeed, the endorsement of the most ambitious and comprehensive political declaration on health in history raised hope for all of us, millions of people, including, as you've said, women, children, adolescents, who do not have access to quality health services or are being pushed into poverty because they have to pay for healthcare, as Mercy has reflected. Just a few months later, the entire planet was hit by COVID-19, an unprecedented health, social, and economic crisis, which shattered those expectations that we had in September. The COVID-19 pandemic has also exposed and exacerbated weaknesses in health systems, showing that many governments, both rich and poor, neglected to invest in health, social safety nets, and emergency preparedness when it really mattered before the crisis struck. At that point, we had no idea that we were facing a crisis that was coming shortly after our declaration. The review by UHC 2030 of the state of commitment to universal health coverage includes a set of messages for political leaders and country profiles. It is based on diverse stakeholder perspectives which reflect the current situation in countries around the world and asks a very simple question. Are governments taking action towards meeting these commitments? How do we know? And how do we exercise accountability? We are facing huge challenges, but there is hope, ladies and gentlemen. This is why on the eve of this year's UHC Day, everyone in the universal health coverage movement is calling for urgent and accountable action for health systems that protect everyone now, because you know what? Lives are on the balance. I want to encourage all of you to take action immediately by amplifying our messages for political leaders and also using the country profiles for national review processes of progress in your country. At the same time, use them for the preparation of the next voluntary national reviews of the UN high-level political forum. And here is the video.
Today we know that people are anxious about their health, their finances, and their futures. Trust in some governments is eroding.
Poor and marginalized communities are being pushed further behind. Frontline health workers desperately need your support. Too many decisions are being made without key stakeholders. Too many policies are gender blind.
But there is also hope. We urge all of you to take these actions with us.
Thank you very much, Dr. Gadenji, for that video. And the take-home message for me is that, we learned that health is a political choice, and we need this strong political leadership to beat COVID-19 and address the needs of everyone, including women, children, and adolescents. And this is very crucial to universal health coverage. Now, our next panel exemplifies this leadership and features strong leaders who are making an impact and are working to ensure that women's, children, and adolescents' health and well-being are protected during this pandemic. We will hear from heads of states, current and former ministers, and global health leaders during this panel, which will be facilitated and led by the Right Honourable Helen Clark, Board Chair of PMNCH and former Prime Minister of New Zealand. And we will hear about the importance, like I said, of political will and leadership to ensure global health security and universal health coverage. Welcome, Helen, and once again, it is a pleasure to share this virtual stage with you.
Thank you, Mercy, and greetings everyone from New Zealand in the middle of the night. And thanks all for joining us, and of course, especially our panelists who I'll be introducing in just a few moments. As Mercy said, this is an opportunity to take stock of the impact of COVID-19 on the health and rights of women, children, and adolescents. COVID-19 continues to dominate the news cycle and impacts on the lives of all of us. Every day brings more new cases and a mounting death toll. But as vaccination is just beginning, there's also hope that the world can overcome this catastrophe if we stand together and ensure that the new vaccines and treatments are available to all. So today's leadership dialogue is going to reflect on global health security, on universal health coverage, on the health of women, children, and adolescents, and the importance of leadership. There can't be effective health security at the global or national or local levels without strong public health infrastructure and without universal health coverage. In response to this pandemic, for example, we've seen how testing, tracing, and quarantine systems have had to be developed very rapidly, where either none existed before or where the capacity was weak. Where there were marginalized populations not adequately covered by health services and systems, the response to the pandemic was made that much harder. So public health measures and primary care do provide the very first lines of defense when you're fighting an infectious disease epidemic. It hasn't gone unnoticed, of course, that among the countries with the most effective responses, a number are led by women. And those leaders have done well because they've put people's health at the very center of their concerns. They've been empathetic, they've been consultative, they've been prepared to listen to advice. The quality of leadership always matters, and it matters especially greatly during times of crisis like the pandemic. Just on that note of the participation of women in the response, we want to hear from everyone who's tuned into the session now, and we're going to ask you to respond to a question which is going to miraculously pop up on your screens. And that question is going to say, when it pops up, what proportion of COVID-19 National Task Force members are men? And it's a multiple choice question. You can choose 50%, 75%, 85%, or 95%. So if you can respond to that question as it comes on your screen, we're going to come back later on with the actual answer and the implications of it. Throughout the discussion, we're inviting you to use the chat function underneath, at the bottom of the screen, and send through your comments and questions. And we hope we'll be able to get time to get to some of them. So I'm going to now introduce my wonderful panel. I will start with Dr. Gro Harlem Brundtland, who was Norway's first woman Prime Minister. I might say a role model for me. When I became Prime Minister, there weren't too many women Prime Ministers around the world, and Gro was one of them. She served 10 years between 1981 and 1996. She was Director General of the World Health Organization from 1998 to 2003. She's a founding member of the Elders, And very relevant to today's discussion, Dr. Brundtland is currently the chair of the Global Preparedness Monitoring Board. And that is a board which exists to promote preparedness and response capacity for disease outbreaks and other emergencies with health consequences. Next, Mrs. Graça Michel, the founder and chair of the Graça Michel Trust, an organization which reflects her lifelong commitment to women's and children's rights. Graça was active in the struggle for Mozambique's freedom from colonization, and she was her country's first Minister of Education. She is a founding member of the Elders and also previously chaired the board of PMNCH. Adrien Taquet is the Secretary of State for Children and Families in the Ministry of Health and Solidarity in France. Throughout his career, he's championed the rights of children and is currently leading work in France to tackle the problem of sexual violence against children. The Minister will need to leave us just a little bit early, but we're very glad to have you here. Next to Lois Pace. Lois is the President and Executive Director of the Global Health Council based in Washington, D.C. Lois was recently named as a member of the Biden-Harris Transition COVID-19 Advisory Board, and we really look forward to what Lois has to say. And finally, joining us from Barcelona, we have Emilia Saiz, Secretary General of the World Organization of United Cities and Local Governments, the largest organization of local and regional governments in the world. So let's start with the topic of global health security. And my first question is going to go to Dr. Brundtland, the co-chair of the Global Pandemic Monitoring Board, as I said, which issued its first report in September last year. When you look back at that report now, it's rather eerie, because that report warned that the world needed to prepare for a high-impact respiratory pathogen which could infect a large number of people very quickly and cause immense loss of life, damage economies, and create social chaos. Hello. Clearly, our world was not ready when COVID-19 struck. Dr. Brundtland, why, in your opinion, did your warning and so many other warnings before yours about a pandemic threat fall upon deaf ears? The floor is yours.
Thank you, Helen. Well, preparedness has long been the subject to panic, cycles of panic, and then neglect. Part of the problem rests with the nature of public health interventions. They protect us from threats we may not actually see in our daily lives or even in our lifetimes. It is all too easy for more obvious and pressing concerns to take precedence. Preparedness is a long-term investment that has to be sustained. Now, COVID-19 has exposed the failure of this approach and has underscored the urgent need for a more holistic framework for pandemic preparedness, public health, and universal health coverage. Although the recent results of vaccine development trials offer hope that transmission of the virus can be contained, there can be no quick fix to the current health crisis the world has been hit by. And this is why the elders have issued a new report called Building Back Better for Universal Health. We recognize that national moves towards UHC must go hand in hand with multilateral efforts to strengthen global health systems. Solidarity must lie at the heart of all future efforts, from vaccine production and distribution to access to medicines, and covering all groups in society, and always women, adolescents, and girls. We summarize our positions there in the 3 Ps: prepare public health systems for future pandemics, prioritize universal health coverage at national and global level, promote healthier societies. In many countries, years of public spending cuts and rising inequalities have damaged health and social protection systems and created more vulnerabilities. In some of the places most severely impacted by COVID-19, healthcare systems were understaffed and under-resourced. It is shocking to think that after years of warnings about a respiratory pathogen, many countries did not have enough masks and other PPE stockpiled. The pandemic has also exposed the vulnerability of groups, the elderly, the homeless, that have been marginalized even in the richest countries. Before the pandemic, there was clearly a false sense of security, a feeling this cannot happen here, especially in countries that have not experienced recent outbreaks like SARS, MERS, or Ebola. So it is not just about COVID, it is not just about the investments as such, it is also about political leadership. Countries that have fewer COVID-19 cases and deaths have leaders that have reacted quickly with policies based on science and evidence. For example, in Korea and in Taiwan. Thank you, Helen.
Must unmute myself. Thank you very much, Gro, and really so important the work you're doing with the Global Pandemic Monitoring Board. I want to now come to Graça Michel. Graça, a report launched today by the elders, which Gro Harlem has just referred to, points out that healthy societies can only flourish when the root causes of disease and sickness are tackled. Those root causes include poverty, malnutrition, gender inequality. We know that COVID-19 has had enormous ripple effects on the health and rights of women, children, and adolescents, whether that be because of missed vaccinations, reduced access to sexual and reproductive health services, and rises in violence. Universal health coverage provided through resilient health systems would undoubtedly help reduce the health impacts of a pandemic. So at this conjuncture, my question to you, Mrs. Michel, is how do we convince leaders that investing in universal health coverage and in primary healthcare services for women, children, and adolescents is really their top priority? You have the floor.
Thank you, Ellen. The still unfolding social and economic disruptions caused by the pandemic are a stark reminder of the importance to prioritize prevention, preparedness, and to build resilient health systems, which affirms the need of the universal health coverage. Let me just remind us of some of the numbers we are talking about. According to a recent report of UNICEF responding to Protect the Progress, just a few numbers. As from November 2020, 572 million students are affected across 30 country-wide schools closures, which says also 33% of the enrolled students worldwide. So then we have an additional 6 to 7 million children under the age of 5 who will suffer from wasting or acute malnutrition in 2020, a 40% rise that will translate into more than 10,000 additional child deaths per month, mostly in sub-Saharan Africa and South Asia. 31 million additional cases of gender-based violence due to 6 months of lockdowns. 13 million additional child marriages taking place by 2030 that otherwise would not have occurred, and 7 million unintended pregnancies in the coming months due to ongoing lockdowns and major disruptions to health systems. So as we can see, the pandemic threatens decades of progress, interrupting global progress on the Sustainable Development Goals as well. For example, we now know that the COVID-19 pandemic has managed to set back 25 years of progress immunization coverage in only 25 weeks. This unprecedented moment in history requires all of us, each and every single nation, to ensure the continuity of essential services for mothers, children, adolescents, and to scale proven solutions with a defined focus on country results. As one of the most cost-effective and far-reaching health intervention in global health, we must maintain, restore, and strengthen routine immunization as a platform for integrating additional high-impact PHC services, including maternal health, nutrition, water and sanitation, and gender-based approaches into national policies and programs. We cannot achieve UHC or meet SDGs without this type of investment and global solidarity. COVID gives an unprecedented opportunity to address these vulnerable groups in a way which does not leave anyone behind. UHC gives the best foundational and comprehensive approach to recovery and bridges inequality COVID has unearthed as it leaves no one behind. No one is saying that UHC is a panacea, but stronger health systems undoubtedly enable countries and communities to rebuild quicker and more effectively. Finance ministers, for example, they have to be convinced not to see investment in health systems, and especially primary health care services for women, children, and adolescents as a cost burden, but rather as a down payment that will yield exponentially large rewards for the entire societies and economies in the coming years. The elders, as my sister Brundtland has just indicated, they just published our policy paper, which is prepare, prioritize, and promote. And I'm not going to dwell on this, but this is what leaders, heads of states, ministers have to hear the numbers we are talking about, and to hear also that there's no other option than really to take the foundational approaches which will pay rewards in the future. So the fundamental arguments for and imperatives behind UHC remain the same and will continue to apply once the threat of COVID-19 has passed, providing a safety net for the poorest and most vulnerable members of society is in everyone's interest as it strengthens social cohesion, economic productivity, and healthy communities. It also is the best way to strengthen collective health security to protect us against future pandemics.
Thank you, Graça. And I feel that a copy of the elders' report should be in the mail to every president, finance minister, and minister of health with that compelling case that you've outlined. Can I come now to Minister Take? Minister, COVID-19 has forced governments to innovate in how they deliver health and social services, particularly during those lockdowns. During the pandemic, we've seen these reported rates of violence against women and children rising around the world. Could you tell us how France has innovated in addressing domestic violence in these challenging times? And would you expect the innovations that you've introduced to outlive the pandemic? Minister, the floor is yours.
Hello, Ellen. Thank you. Thank you very much. Hello to you all. Well, actually, I don't know if we've been innovative. At least we tried to be efficient. And we did our best to do so because we know that these questions of violence against children are particularly hard to address. But it has been one of our main concern during this pandemic, and especially during the first lockdown, because during the first lockdown, schools were closed in France, which is not the case now. But during the first lockdown last March, April, it was closed. And so we lost our primary source of information on child abuse by closing the schools. And secondly, we were very concerned because, as you may know, I guess it's the same in other countries, but in France, 80% of child abuse are made within the family cycle. The kids were sent back to their family. So we had, in order to respond to that, we had to multiply the point of contacts, the channels, in order to detect and to signal child abuse. So we built a lot of partnerships with TVs, radios, but also, of course, with digital media, because that's the use of our kids, and such as partnerships with networks and such as and platforms such as Snapchat and TikTok and stuff like that. We also developed the use of tech services that were built firstly for people with disabilities that we used for the children. We also made partnerships with local malls, with local pharmacies, with social landlords also, to have posters in all these places in order for people to be aware that there was an issue concerning violence. And of course, we also increased the number of professionals in this local phone number. It's 119 in France, where you can call or contact by digital platforms to signal a kid who is in danger. And there's been a big increase in calls to this phone number during the crisis and the first lockdown by more than 50% with regards to normal times. But at the same time, there's been also an increase by 35% of calls by neighbors and also by friends of the children. So I want to believe that we've been progressing in terms of awareness of this issue, and in terms of creating some kind of a reflex among the French population that there's an issue with regards to violence against children, and that we still have to be very concerned by it. And in any doubt, you have to call this number and to be aware of that. Just to mention very quickly that there's another form of violence, an indirect consequence of the COVID-19 and of this crisis, and that I believe we have to be very careful in the coming weeks and months, is the psychological effect of the crisis on our children, may they be very babies or adolescents. I think it's in front of us, and we have to be very, very careful about that, and we are working on that issue. And another second point, very quickly, I want to share with you is that there've been, of course, I guess in the other countries the same, massive increase in violence in the digital space. Notably, there've been a fall down of school bullying, but the digital, the cyberbullying has increased significantly, as sexual blackmail also. among children. And the government platform we have, there's been an increase of more than 50% of contacts during the first lockdown, and it's still very high right now. So there's a digital issue, specific one. We know it even before the crisis. We know we have to provide a better protection to our children in the digital era. And remember, in 1989, when the International Convention for the Rights of Children was elaborated and signed by all the countries, internet did not exist. And actually, it means that within the convention, there's not that much concerning the protection of the children in the digital age. That's why last November 20th, I launched an initiative with Elena Bonetti, who is my counterpart in Italy, in order to draft a political statement to enrich the International Convention in order to reinforce the protection of our children in the digital age. So we have a draft of a declaration, political one, and I just want to invite you, all states who are here around the table, and also NGOs, to come and join this initiative, to work on that draft and to make it sign it and to make it adopted maybe for the next General Assembly at the United Nations next September. The very, very last, I promise, Hélène, just to tell you that I launched yesterday an independent commission in France on incest and sexual abuse. It has been the case and has been done in other countries before us, in France, Germany, in the Netherlands, in Australia, in Ireland. And so we are doing the same work here in France. It's a main issue. It's a taboo. I don't know if you can say that in English. I think it's the last taboo, and we have to crush it. And this commission, independent commission, is an important step, I believe, forward on the path of a better protection of our children.
Well, thank you so much for telling us of those initiatives. You may be interested that a Lancet WHO UNICEF commission that I co-chair that reported in February looked at this issue of the, if you like, the commercial exploitation of children, which can also, of course, occur through these social media channels. And we've made a recommendation for an additional protocol to be negotiated to the Convention on the Rights of the Child. So maybe we should come knocking on the door of the French government now because there's a lot of synergy with what you're saying. So thank you so much. And we know you have to go. So if you fade out, please don't feel embarrassed. But
I'm sorry about that. See you later, and talk to you soon later. Bye-bye. Bye to you all.
Thank you. Thank you. Let me come now to Lois. And as I said, Lois has a very, very exciting position at the moment on the transition team on COVID in the United States. And Lois, you will be acutely aware of how the pandemic has exposed the inequalities that have been there and have been so obvious, but it's highlighted them in the US, and it's coincided with the broad-based social movement for racial equality and justice, which is Black Lives Matter. In your view, Lois, what will it take for the inequalities that are now being exposed so effectively by Black Lives Matter and by COVID-19 experience to be acted on as the US seeks to build back better and recover from COVID-19?
Well, first off, I just have to say how honored I am to be a part of this panel. It's just very exciting for me, and I'm grateful to you and the organizers for inviting me to join you here. I appreciate this question too, given who I am in this body. And so I think personally, for me, it's been a pretty big year running a global health organization, fighting a pandemic, but also being a part of what's been a long overdue racial reckoning in my country, the US. This question I like as well because it allows me to step back and at least give my sense of things. I do believe that the movement for Black Lives really was instrumental in helping people here and around the world understand truly what Black people have been facing, particularly Black men, but also Black trans folks, Black women, and others around the violence we face, the very real violence and threat thereof. And yet, it's interesting because I don't think that people have made the same connection with COVID-19. And what I think we still need is for people to have that same aha moment. So what do I mean by that? We know that people are being choked to death, right, by police officers and gunned down. And these images, unfortunately, these stories have really struck us to the core. And there's really no denying among many of us that that's real. And yet, when we look at the rates of COVID-19 among Black and Brown and Indigenous communities, people don't truly understand what it means for Black people to be dying at twice the rate of their white counterparts, right? I don't think that struck the same nerve for people, that reality. And that's at the lower end of those statistics. You know, you look at other death rates or hospitalizations and you see those numbers climbing. And yet people aren't marching in the streets in the same way for the same reasons. Certainly the core of the Black Lives Matter movement was, but I think many of the allies weren't connecting those dots. And even if you take beyond the COVID crisis or the acute health issues around the COVID crisis and extend it to the economic issues, you see the same exacerbation. You know, we talk about gender equality, for example, and we recognize that women are paid on average 80 cents on the dollar or, you know, maybe a bit more compared to white men. But then when you look at Black women or brown women, you see those numbers decreasing, right? In the 70s and even 60s in some cases. And so what does it mean for people to be out of work, right, in this moment? And what does it mean for that gap to be widening? So I think that is the connection I would like to make, all of us. And I would love to find some way to continue to tell that story. I think you have the president-elect's transition team recently establishing a racial and ethnic disparities task force around COVID-19 for this very reason, because they're wanting to connect those dots. They're wanting people to understand that just as emboldened as we feel by the violence against Black lives and Black people, we should feel that same rage, frankly, and concern and sense of urgency around health violence, around access to care, right? And access to vaccines when it comes to it. So that's what I think it's going to take, is really making that even more clear to people. And I'm hopeful that we can do that in the coming weeks and months.
Yeah, and we really look forward to seeing how it will be addressed, because there's such long-standing health inequities, and it's not one swing of the wheel, right? It's a whole lot of structural determinants that you're going to need to look at. So all speed to you in this important task of advising on that. Thank you so much. Let me come to Amelia, whose organisation represents, I'm told, more than 250,000 local and regional governments and associations around the world. Of course, cities and local governments are also on the front lines of the COVID crisis and response. And I wonder, Amelia, can you tell us what are the key challenges that local governments have been facing, and how could they be better supported to deliver on an effective response?
Thank you very much, Helen, for the question, and thank you for the opportunity to bring the local government perspective to this discussion, which is extremely important, right? With over half of the world's population living already in cities, the local government perspective is very critical. If you ask me what is the challenges, well, the challenge is probably that we were not prepared. We just simply were not prepared, but also the disconnect between the health system and other parts of governance is very worrying. We had the health crisis, and then we decided to go into lockdown, but water had to keep running, waste had to be picked up, and all of this had to happen with a disconnect between the health system and the public service delivery system, in a way. I think that will need to be addressed. Also, huge issues around inequality, and inequality that our cities have been built on, right? We have accepted inequality, and that inequality has spread out in a way and has been made very obvious by this pandemic. Local governments face the fact that the people that had to care for us in this pandemic were the ones that were paid less, were the ones that were less recognized, were the ones with less capacity, and those same people that had to care for the collective also had to take care of the most vulnerable. So how do you reach these people? People had to be transported to their work. Mobility had to keep going. Local governments have been making an enormous effort that now we are very concerned about, because the effort was needed to keep the transportation running even without the income. Transport around the world run for free in many of the cities. Same thing for other public service delivery. Now we are very concerned that we might not be able to maintain the public service delivery ecosystem. The recovery plans are not really looking into that. How can this change? Well, there needs to be a different ratio of investment in local service delivery, and local service delivery will probably need to have a different space in the national and federal agendas, if you ask us. Also, we will need to be able to pay the municipal workers much more if we want to have the top of the quality that we need for the urban era challenges. So these are some of the things. Our frustration is we knew these things before, and yet the system was not ready to tackle them.
Mm-hmm. Yeah, well, lessons learned, and I think that's so critical to not having it hit us the same way again. So great that you're, analysing that so effectively, and to be able to inform your constituencies too. Let's come back to this theme of leadership. And when Gro Harlem Brundtland spoke earlier in the session, she emphasised what the Global Pandemic Monitoring Board had said about the importance of political leadership. It makes a difference. If you don't have good political leadership, the response isn't going to be so great at any level, whether we're talking local, national, or global. Gro, in your time, you were a senior leader in the multilateral system as the DG at the WHO. When we look at the multilateral system as a whole now, it appears somewhat weakened and often under attack. In your view, what needs to be done to boost multilateralism and its institutions again so that they can give better leadership in preparing for and tackling pandemics?
Yeah, Helen, as you know, I was Director General during the SARS crisis in 2002, 3, 4, and I can tell you, we would not have been successful in stopping SARS without global cooperation. Today's pandemic is of a greater magnitude. But again, the brightest spots in the response have come from international cooperation. Scientists from around the world have worked together to develop vaccines in record time. New multilateral mechanisms, including the ACT accelerator and its vaccine pillar, could bring treatments and vaccines against COVID to millions, hundreds of millions around the world. If countries, enough countries, participate and support these initiatives. All leaders must now commit to renew and support the multilateral system and give it the political empowerment and resources it needs to function efficiently. This is what was lacking and that we have experienced the consequences of. The post-war multilateral system has contributed to better health and living standards for hundreds of millions, but it is also in need of reform. We must strengthen both WHO and other international institutions so that they can lead the fight against pandemics. This means reforming what we call the international health regulations and to give the Director General the necessary powers to act. we need a system that facilitates coordination between sectors, but also across levels from the community to the global level, as Emilia was just addressing. The GPMB has, because of all of this, called for a UN summit on global health security to adopt an international framework for health emergency preparedness and response. This framework would reinforce the multilateral system by addressing the existing gaps, including in financing, multi-sectoral preparedness, and R&D, and improving governance through stronger accountability mechanisms. COVID-19 has shown us that narrow nationalism and isolationism offers no protection to a deadly virus. The same applies to other existential threats facing humanity, including climate change and nuclear proliferation. It is ironic that the world has faced this pandemic in the year that marked the 75th anniversary of the United Nations. This just illustrates how we need the UN as the essential guarantor of health, freedoms, and the rights of all people in the face of current and future threats. Thank you so much.
Thank you very much. And on that theme of global solidarity being so important, let me come back to Graça Machel and reference here the Sustainable Development Goals agreed 5 years ago. It seems like a lifetime, but it was only 5 years ago. A universal agenda, which of course needs global solidarity to be achieved. But today, as we see all these pressures mounting created by the pandemic and the response to it, we seem to hear a lot more about investments in national responses than we do about contributions to global solidarity. So can I ask Mrs. Machel, how do you think we can make the case for deepening global solidarity so that we can keep making progress on the SDGs? At the moment, the trend's going in the wrong direction. How do we enthuse people with the need to get back on track through a spirit of global solidarity?
Thank you, Helen, again. You know, COVID reinforced just how interconnected we are as a human family and made us touch and feel our common humanity and vulnerability. We had a good example of the COVID-19 vaccine being developed in less than 1 year. And it gives me hope as it demonstrates that when we feel it urgent enough, we can find the necessary political will, financing, and expertise to act in ways which transform society and benefit all of humanity. Researchers really gave us a very good examples. They broke down traditional barriers of scientific discovery. And I hope governments, big and small, private sector, from east to the west, and academia, civil society, regardless of sector, they have been all focused on and exploring ways to work together and respond to the impact of COVID. So it has been proven that we are able to break the sense of nation. We can break the sense of north-south divides, the divides between men and women, rich and poor, and even religious and ethnic divides. We can focus purely on finding a solution. So countries are striving to ensure equity in vaccine availability. And so far, they're still working together, focusing on that. For SDGs to succeed and to come back to the center of the global agenda as the path we have all agreed that it's the one which is going to take us to overcome poverty, to bridge inequality, to build societies which are cohesive, and we keep this relationship amongst us in which we know either we fall together or we stand together. So the research for vaccines should be taken as a reference point for us. And this approach to global solidarity, implemented with all challenges that we face as human family. And we need to remind every single head of state who have signed up to SDGs that yes, we said this is the only way as human family we can prosper together. And this, I believe, is the opportunity which is given to us that when we put our political will and when we focus on finding solutions, we can make it. And this is the hope I see to bring the SDGs to the center of global development and also to reinforce the global solidarity, which we have shown it is possible. And now we have a very fresh reference of how it was done, and that is the future. I think we should build on in this reconstruction process post-COVID.
So I think your message is, yes, we can.
Yes, we can.
Message. Yes, we can.
Thank you, Helen. You got it right.
I think there was a campaign around that a few years ago. And that brings me nicely back to Lois Pace. Lois, the Universal Health Coverage 2030 report indicates that a factor common to countries which have performed well in their response to COVID-19 is the willingness of political leaders to heed science and evidence-based advice. So here you are as a member of the Biden-Harris Transition COVID-19 Advisory Board. You're facing a lot of challenges, not least this infodemic of misinformation about COVID. So what steps do you think can be taken to depoliticize and rebuild trust in science, which is so critical to getting an effective response?
Yeah, Helen, I'm actually really worried about this very issue. I think a lot of us on the board are. I think a lot of us in this country are, right? And it keeps me up at night because I don't know where we go from here exactly. I think we're going to certainly try and work towards that. And you hit the nail on the head when you talked about the importance of depoliticization. I've heard the president-elect talk about the same and really implore people to remove politics from the situation as much as possible, and really think about how each of us is increasingly affected by COVID. As our numbers climb, it's going to be the case that someone will know someone who's been affected if they haven't lost their lives, unfortunately. And I'm hoping that will allow each of us here to appeal to our better angels, so to speak, and really be able to step back from the controversy. But it's not a given, and misinformation, disinformation is real. One of the things I know we've talked about here as well is being empathetic to sort of the very real basis of fear I think some people have. It's not all politics. Honestly, the hesitancy around vaccines, for example, is grounded in some harsh realities in this country, particularly among communities of color who have experienced the ill effects of being mistreated in the healthcare system, of being sort of used as petri dishes ourselves in ways and in very unjust ways. And so really meeting people where they are with their questions, really honoring those and trying to identify not only the message, right, but the messenger who can best communicate sort of how we got here with the vaccine and why it's so important to still wear masks and, so on and so forth. I think that's how we're trying to approach it. But it is a very tall, tough hill to climb in our estimation. And it is, it's interesting that one might assume that the innovation is the tough part. But as dear Gracia Michelle said, we actually have a vaccine within a year, right? And that's incredible. But it's not just about the vaccine, it's about vaccinations, as the president-elect has said. So, and a lot of that is, as we know, social and behavioral and, the tougher stuff in public health. So it's not the answer, but it's at least how we're trying to approach what can really be a really tough situation.
Well, we wish you well. We know how tough the pandemic's been on the people of the United States, and particularly, as you say, on people of color. It's been horrific. I saw one statistic that registered with me that said something like 30% of the population of Chicago is African American, 50% of the COVID cases and 70% of the deaths. Horrific. So a lot to fix. Amelia, an impact of COVID-19 has been in a number of places for breaches to occur in the social contract, reinforcing the need for governance which is participatory and truly reflective of the needs and priorities of people. So I wondered if you could share with us one or two brief examples of measures which local governments are putting in place in this challenging time to ensure that they really are responding to the real needs of their constituents.
Yeah, one of the characteristics of local governments, because they are so close to the people, they are neighbors. They need to act whether they have the capacity and the mandate or not. The problem is at their street level, and they need to react. And they have been taking measures which are very diverse. They have very quickly reacted to the issue of women being threatened at home and the increase of violence. They have organized codes, for women to go to pharmacies and ask for a certain medicine and in that way get attention. They have made sure that the children that couldn't go to school received food baskets one way or the other. One of the key issues during the pandemic everywhere in the world has been the issue of housing. Many local governments do not have the competence over housing, but still they have been pushing their national and federal governments to avoid evictions, for instance. They have had to deal with the private sector and ask the private sector to provide internet access to many families that otherwise would be totally disconnected from reality. They have had to make use of public spaces and public buildings in a totally different way to get migrants to move into empty buildings, etc. The challenge now is whether we can make these temporary measures sustainable. If we are able to do this during a crisis, why can't we do this as a society? It needs to be possible. Look, we know that the local level is not able to solve everything, and we shouldn't be solving everything, but we are certain that we have a role to play as sentinels of the dreams of the communities, to safeguard their ambition. And we also know that surviving is not enough for humanity, So we see culture also very much as an antidote to the problem that was expressed by our French colleague, mental health. We need to be creative, and many cities around the world have put their cultural platforms online, streamed, so that we still feel part of the community. We feel at local level that probably we should not be talking about social distancing, but rather physical distancing and social cohesion. And if you ask me, Helen, that is actually the big challenge going ahead. We need to work together, and I couldn't agree more with Ms. Brundtland when we said we need a very strong multilateral system, a much more inclusive multilateral system, where local and regional governments have also a seat for those issues that are going to be affecting communities directly. But we are hopeful. We are hopeful that we will find our way out of this better together.
Absolutely. Now, at the beginning of the panel, remember we had a little poll and we asked our audience what they thought the correct proportion was of what the proportion actually is of National Task Force members who are men around the world. Now, 44% of you got the answer right. The right answer was that 85% of members of COVID-19 national task forces around the world are men. So can we be surprised if responses haven't been terribly gender sensitive? And yet we need gender sensitive responses for all the reasons that have been talked about on the panel. You've been a wonderful panel of trailblazing women and the male champion also of gender equality and the rights of children. So we're going to have a very quick closing round, a lightning round. I want just one or two sentences from each of you, your words of wisdom. How can we get more women into leadership roles quickly to try and deal with this gender blindness and decision-making issue quickly? So I'm going to call on the panelists in reverse order. Emilia, what would you do?
Well, what we are trying to do is to get more women run for public office at local level. We think that if civil society teams up with the local level, we can get much more women to break that glass ceiling.
Absolutely. Lois, what are your two sentences?
Well, we all know that it's important to, when we walk through that door, leave it open for the rest of us. But I think sometimes we need to find our own key. I know what I do is if I put on an event, I will create an advisory committee of all women of color. And guess what? Those are all my speakers, moderators, everybody who's on stage. I'm in the background, right? So that's what I think we need to do too, be creative and just put people that we know deserve the spotlight front and center.
Fantastic. Graça Michelle, your words of wisdom on this.
Women have been always portrayed as the victims of poverty, of COVID, but women are really leaders who have shown us that in this period of crisis, they provided the best of leadership. 7 countries led by women are the best performance in this reality of COVID. Germany, New Zealand, Taiwan, Norway, Finland, Iceland, Denmark, you name it. Women are a force to be reckoned. Women are the strength which is going to help a human family to get out of this crisis of COVID. So let's have women in all discussions and decisions which are taking place to find solutions for us to get out of this crisis. I'm sorry, it was not 2 sentences.
No, but the passion came through. Gro, you get the last word on this.
Well, be like Graça, show your passion, use your voice, and speak out with courage. That's what will make women leaders.
Show your passion, use your voice, and speak out with courage. Well, what a wonderful note to end our panel on. Thank you so much to all of you. And I hope we've set the scene for the Lives in the Balance Summit to roar on and really get people, very inspired about being active around the issues of women, children, and adolescent health, which underlie the whole focus of the summit. Thank you so much, and I'm going to hand it back to Mercy. Come in, Mercy.
Wow, thank you very much, Helen and our esteemed guests. That was such a powerful discussion and a very, very powerful panel with leaders who continue to fight for change and who are already working to protect everyone and the progress that we've made so far. And, for me, it's just becoming clearer how important it is that when we have a chance to pick our leaders, we have so many things to consider. What is their passion? What are we choosing? Are they people who will fight for all of us? Are they people who will fight for the interests of the people? It is so encouraging to see that already we have some of those leaders with us. And we're hoping that going forward, we will have even more joining such. Now, at the beginning, we promised you an inspiring, engaging, and fun event. And that is the package we're delivering to you. I think we can all agree to that. And next, we're going to get some inspiration and fun. And on that note, I welcome on screen someone very special. She's a singer, rapper, songwriter, and yes, a young woman who is driving change for women's and children's health and rights through music. She is joining us today to perform a beautiful song written specifically for this event. Please, ladies and gentlemen, join me in welcoming to the virtual stage Abelone Melese, UNICEF Goodwill Ambassador to Ethiopia. Abelone, the stage is yours.
Thank you so much. Thanks for having me. So we're going to perform a song that's especially made for this event. I hope you all will like it. Can't let the shadow come and win so easily. We getting stronger by the day, as you can see. Even through the hardships, we ain't giving up. We staying done this for the days to come. Yeah, a brighter future where we all live equally. For the children of this world to have opportunities. The only way is to stand together in unity. Everything is possible when it's you and me. Ooh, through the stormy weather, we'll make it together. It's gonna get better. We won't surrender to the storm that's gonna come. Oh, we gotta stay as one. Through the tough times, together we'll be fine. Trial, tribulation leads to a road of greater nation. Life's so unpredictable, we make it cause we patient. Our biggest motivation is a world with better changes, where women and the children get liberation. Ooh, through the tough times, together we'll be fine. It's gonna get better. We won't surrender to the storm that's gonna come. Oh, we gotta stay as one. Through the tough times, together we'll be fine. Together we'll be fine. Ooh, through the stormy weather, we'll make it together. Ooh, it's gonna get better. We won't surrender to the storm that's gonna come. Oh, we gotta stay as one. Ooh, through the tough times, together we'll be fine.
Wow, that was beautiful, Abelone. You sing so passionately about women and children. Is this your first performance on Zoom?
No, this is not the first performance. I've been doing this line of work, making songs that are really true to my heart for ever since I was 18 years old. I think I started in 2014 and I haven't stopped ever since.
Please don't stop. Please don't stop. That was really beautiful. And in this song, you emphasize on togetherness and going through the tough times as one unit. And this is a message we have seen even in the leadership panel. The leaders we had all asking that, we don't leave anyone behind at this time, ensuring no community, no country, no vulnerable groups are left behind. How is this message, how important is this, our quest for better healthcare and well-being for all? How is togetherness important?
I think in order to have any sort of changes and that vision we want for the future, we will only get there if we do everything together. That's when a really strong change is going to come. So togetherness is key.
Thank you very much, Abelone. And your lyrics today instills in me a hope for a better future, because although we are living through unprecedented difficult times, especially for women, children, and adolescents, we are also seeing the renewed efforts and commitments by governments and countries in ensuring the health and well-being of this vulnerable group. Now, this next panel is part of a broader and ongoing effort for global solidarity, meaningful engagement, political leadership, and concrete action towards addressing the crucial needs identified by women, children, and adolescents. By you. These needs were identified by you in the call to action. And now we're going to hear from young leaders on some of the challenges they are facing and the asks they are highlighting. In response, we will hear from governments and policymakers on how they will address these asks. So join me in welcoming Honorable Minister of Health, Dr. Ahmad Jawad Usmani from Afghanistan, Secretary in the Ministry of Health and Family Welfare, Mr. Rajesh Bhushan from India, Honorable Minister of Health, Dr. Osage Ehanire from Nigeria, Honorable Minister of Health, Dr. Wilhelmina Jala from Liberia, and Cabinet Secretary of the Ministry of Public Service and Gender, Professor Margaret Kobie from Kenya. They are joined by youth advocates, Masuma Jafari from Afghanistan, Shukti Ananta from India, Toyin Chukwudozie from Nigeria, Jutomwe Dotin from Liberia, and Paulina Nyona from Kenya.
Welcome.
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 Welcome to our global summit.
To our global summit.
I'm a youth advocate from Afghanistan.
From Nigeria. The Republic of Liberia.
From India.
I want to tell you about the needs of women,
children,
and adolescents. In this time of COVID-19, more than ever,
we urgently need
our rights to sexual and reproductive health services.
Quality, respectful, and dignified health services. Supplies and medicine.
Family planning.
Free or affordable services.
Vulnerable and asylum-seeking families need food and shelter, clean water. Gender equality.
Protection from violence.
It's time
to move from commitment
to action. To action.
Hello from Afghanistan. Women, children, and adolescents in Afghanistan tell us they need better access to health services, quality, respectful care, gender equality, social protections, and protection from violence. So I'm here at the Ministry of Public Health of Afghanistan to ask our Public Health Minister, Dr. Ahmad Jawad Usmani, about his plans in these areas.
I am personally committed to improving the health of mothers and children, and I'm dedicated to allocate right and adequate resources for improving the health of mothers and children through investment in our MNSEAD services.
Hello from India. Young people in our communities tell us they need access to stigma-free, non-judgmental, quality SRH services, supplies, and information. So I am here to ask my Union Health Secretary what he is doing about that. Thank you so much. It's a great honor and privilege for me to be talking to you today. It's very overwhelming for me. So thank you so much for coming on the interview.
In fact, don't let it overwhelm you,
This is a pleasure for me also.
India has pledged towards improvement in women's, children's, and adolescents' health, including mental health and well-being, and is attempting to make better changes in this area. So I wanted to know how you will invest in and prioritize the health, well-being, and rights of women, children, and adolescents during the COVID-19 pandemic and beyond, and what will this achieve?
We have directed our energies and we have repurposed our existing national programs towards the protection and the well-being of women, children and adolescents. We have already committed to implement a COVID-related health sector preparedness plan of $2 billion. That's a huge amount. But then we are a huge country. So we need to put our money where our mouth is. So therefore, whole of the government approach, whole of the society approach, and a multi-sectoral response. And all this is focused to ensure that the vulnerable lives are protected.
Hello from Nigeria, my name is Toyin. Women, children and adolescents in Nigeria tell us they need quality healthcare, access to sexual reproductive health information and services, gender equality and protection from violence. I'm here to ask our Minister of Health what he is doing about that.
I commit to protecting progress made in safeguarding the health and rights of women, children, adolescents and the elderly everywhere through the PMNCH COVID-19 call to action. We reaffirm our commitments to universal health coverage through improved and expanded primary health care and pledge our commitment to action that will arrest and reverse risks to women's, children and adolescent health and well-being, even during and after our COVID-19 response and recovery. On behalf of the government of Nigeria, we commit to building a model that leaves no one behind, but caters to the needs of everyone through strategic interventions that address the needs of children, adolescents, women, and men.
Hello from Liberia. Women, children, and adolescents in our communities tell us they need access to sexual reproductive health and rights information and services, gender equality, and protection from violence against women and girls. I am now going at the Ministry of Health to interview Dr. Wilhelmina Njala, who is the Minister of Health. So I'm here to ask the minister what she is doing about those issues. Honorable Minister, it's an opportunity to see you again because we met in 2018 in Asia for the Primary Healthcare Conference, and for a couple of youth occasions in Liberia at the Ministry of Health. I've also seen you, and it's an opportunity again to see you once more. Can you summarize Liberia's commitment?
Liberia is committed to the PMNCH COVID-19 call to action. We have made allocations of 30% and even more to make sure that things happen. We have addressed all of the gaps in collaboration with key stakeholders, which includes Ministry of Justice, Ministry of Gender, and the Ministry of Health. And we have now put together our accountability framework, which will include the civil society, all of our partners, and the government sector itself, leading to giving this accountability to the president.
Hello,
I'm Pauline Anyona from the Organization of Africa Youth Kenya and the Partnership for Maternal, Newborn and Child Health. So women, children and adolescents from our communities tell us that they need increased access to quality and respectful care and also water and sanitation services. So I'm here to ask Professor Margaret Kobia, Cabinet Secretary for the Ministry of Public Service and Gender, to tell us what the government of Kenya is doing about it.
The COVID-19 pandemic was like an emergency. So the government had kind of to come together so that we could reorganize our budget to be able to support women, girls and the children during pandemic. To prevent gender-based violence, the Kenya government has committed 0.5 of its annual budget to support girls' education, provide water, to provide clean toilets, and also to provide funding for small businesses.
That was incredible. Thank you, Honorable Ministers in Masuma, Shukti, Toyin, Jutomo, and Pauline for your valuable inputs and contributions to this event. And those needs and priorities for actions are so clearly spelled out. So hope we get this conversation going and continue to meaningfully engage young people as youth, are the leaders of today and tomorrow, and have a very big part to play in our response and recovery. So just a quick reminder that we are live in this event and we are asking you to please keep the conversation going on social media. We are under the hashtags, hashtag Lives in the Balance, hashtag UHC, hashtag COVID Call to Action, and hashtag Health for All. And please do feel free to tag the co-hosts at PMNCH, at Co-Group, and at UHC 2030. Now, let's move into our next session, and this is easily one of my favorite sessions in these online events, the breakout sessions, which allow for more engagement with you as we discuss key issues that you have identified in the COVID Call to Action as priorities. We want you to use these sessions to, share and exchange on the solutions being implemented in countries, and we want to hear your experiences and how you are driving change. With utmost pleasure, I now welcome on screen each facilitator of the breakout session who will provide us with just a minute highlights of what their session is about. So we have Andrine Dayambaje. You are the Health Services Coordinator at the University of Global Health Equity, Rwanda. And the session you're leading today is that on access to and use of quality health services. You have 1 minute to give us a brief of your session.
Hello, distinguished experts, activists, and the partners for a better world for mothers and babies. Welcome once again. We are here because we share the same feeling and impact that it is so painful and regrettable to see a mother dying while giving life and a baby dying unnecessarily in health facilities. Because we are aware that the majority of death and fatal complications in health facilities, especially in low-income countries, could be prevented or managed by competent midwives and nurses who have the resources and support their needs. Because we are the voice of those mothers and babies who continue to die in health facilities due to limited investment in midwifery workforces and the current gap in newborn care delivery, especially for preterm, small and sick babies. As more pregnant women give birth in health facilities, we must also strengthen our health workforce to provide a positive pregnant and birth experience for mothers, babies, and families. For more about this, please join us in breakout session 1 on access to and the use of quality health services. Thank you.
Wow, thank you very much, Andre. And now for breakout session number 2 on gender, sexual, reproductive health rights and UHC in the context of COVID-19, let's welcome Anushka Kalyanpur, who is the lead of the Sexual and Reproductive Health in Emergencies Cluster at CARE. Anushka, you have a minute.
Thank you, Mercy. Hi, everyone. So as you've heard this morning, the delivery of essential sexual and reproductive health services has been disrupted and resources reallocated as a result of the COVID-19 pandemic. This has resulted in unintended pregnancies and put women and girls at higher risk of death, disease, and disability from preventable and treatable causes. The impact is further exacerbated in contexts of fragility, conflict, and emergencies where institutional capacity and services are limited. Join our breakout session on gender, SRHR, and UHC in the context of COVID to hear from speakers on promising practices and lessons learned for how SRH services are being delivered amidst the pandemic through the critical lens of gender and localization to amplify and catalyze locally generated solutions to ensuring that no one is left behind. In addition, you learn more about the recently released Ready to Save Lives Toolkit by Family Planning 2020 to learn about how countries can prepare to ensure SRH services are maintained and prioritized for future health emergencies. Thank you.
Brilliant. Thank you, Anushka. And now Olivier de Schutter, who is the UN Special Rapporteur on Extreme Poverty and Human Rights, who will be providing highlights on breakout session number 3 on social protection for marginalized and vulnerable populations. Sir, you have a minute.
Thank you. Thank you, merci, and very warm welcome to all. I'm sure that the breakout sessions that Andre and Anushka introduced shall be fantastic. My role, however, is to present breakout session number 3. COVID-19 has really caught states by surprise. States have been unprepared. And the crisis has shown light on the need to strengthen resilience of societies in the face of shocks, both by social protection floors that are rights-based, standing social protection schemes ensuring basic income security throughout their lives for all individuals, and by ensuring access to water and sanitation and food and nutrition security. And our breakout session will discuss what it takes to convince governments to establish such social protection schemes and to guarantee water and sanitation and food and nutrition security, corresponding to asks number 5 and 6 of the call to action on COVID-19 that was launched in July by the Partnership for Maternal, Newborn and Child Health. And the breakout session shall be chaired by Olivier Ngou, the head of Impact Santé Afrique, and it will bring together, in addition to myself, Catarina de Albuquerque, who leads Sanitation and Water for All, as well as Christina Behrendt, head of social policy at the International Labour Organization. So we very much welcome you in this breakout session, which I'm sure shall be extremely interesting to follow. Thank you.
Wow, thank you, Olivier. And our last breakout session today on social participation is being introduced by Justin Coonan, President of the AIDS Council of New South Wales, ACUN. What are we expecting from your session, Justin?
Hello, everyone from Sydney, Australia. Faced with the unprecedented challenge that COVID-19 presents, it's clear that a siloed approach to global health, which sees governments, multilateral agencies, civil society, the private sector, and philanthropists all working in different directions, will not be sufficient to end the pandemic. COVID-19 is forcing us to re-examine our partnerships and confront differences in our values and modes of operation as we strive for genuine multi-stakeholder collaboration. How can governments meaningfully include communities and civil society in their decision-making processes? How can young people ensure that their voices are heard? How can the private sector contribute and respond to community needs and concerns? And how has COVID-19 changed all of these relationships?
Now to the session leads, you each have 3 minutes to tell us the highlights of your discussions. And once again, we'll start with Andre. Welcome back, Andre. How was your session?
Thank you very much. My session was about access to and the use of quality health services. And all we discussed about was up to say, as more pregnant women give birth in health facilities, we must also strengthen our health workforce to provide a positive pregnant and birth experience for mothers, babies, and families. But how? By comprehensively investing in staff, by increasing the number of competent midwives and the nurses who have the resources and support they need. Space, by creating a safe and enabling work environment that allows midwives and the nurses to implement the existing guideline policies and the protocols. Resources, by well maintaining and using available equipment and ensuring zero stock out of life-saving commodities in health facilities. System, by ensuring health workforces are equitably regulated and remunerated. Support, by creating a multidisciplinary and a teamwork mechanism in which every actor feels responsible and accountable for better health outcome in birth and newborn care unity. Evidence-based and client-centered health services, by using data and client feedback to improve the quality of health services delivered to the mothers and babies in facilities. Continuous professional development and specialized care and courses, by facilitating midwives and nurses to upgrade their levels of qualification and competencies. And this is the role of World Health Organization to support the countries to do so. Quality care must include respective, informed, and dignified care and effective community engagement and family-centered care. We talk about integrated services. These include sexual, reproductive, maternal, newborn, child, and adolescent health, which said about informed and free choice of contraceptive, safe abortion care, immunization, and mental health services. Our team committed about zero death due to preventable and manageable cause in health facilities among mothers and babies, adolescents, and the child by 2035. And we conclude that COVID-19 situation could not stop or impact negatively the relationship between mothers and babies, even the access and the use of existing health services in community and hospitals. Thank you so much.
Thank you very much, Andre. And now to Anushka, please tell us about the breakout session number 2 on gender, SRHR, and UHC in the context of COVID-19. Please keep your comments short. We are looking at 3 minutes and under. Over to you.
Sure. Thanks, Marcy. So I'll try to highlight 3 key points that emerged. Number 1, preparedness. This came up a lot. Family Planning 2020 has recently put out a very helpful toolkit called Ready to Save Lives. And what's really great about this is it really breaks down how we can invest in preparedness to ensure that rights-based SRHR are crucial and part of any emergency response in the future. We talked a lot about how this needs to happen, not just at the government national levels, but also subnational levels and community-based preparedness, including on SRH and pandemic preparedness. Second, we talked a lot about various different lessons learned and several adaptations, which have implications for achieving universal health coverage in COVID and beyond. Like my colleague Andre said, supporting frontline health workers was a really key part of that, especially given that 70% of these frontline health workers are women and have their own dual burdens. But we talked about also providing them with psychosocial support in addition to these other aspects of infection prevention control and all of that. We talked about other innovations like self-care, telehealth, etc. And also about how crucial the leave no one behind aspect is, and how locally driven accountability mechanisms are not only programmatically feasible and effective, but also critical in ensuring continuity of these rights-based SRHR services to be more responsive to marginalized populations, including in complex emergencies. The last point, which was really underlying and cross-cutting for all of this, is the role of gender and power analysis across all of this work. We know that different genders experience emergencies in different ways and have different coping mechanisms. So that gender analysis is crucial to informing our plans and response efforts. And we really need to invest in women and youth leadership in kind of refining our response efforts, both in preparedness, response, and recovery. Thank you.
Great. Many thanks, Anushka. And now over to Christina Berendt, Head of the Social Policy Unit in the International Labour Office's Social Protection Department in Geneva. Christina, can you give us just a brief recap of what your session number 3 was about?
Thank you very much, Mercy. And indeed, it's quite a challenge to summarize our very lively and interesting session in just 3 minutes. But let me do that by just making 5 points that will all start with P. So the first one is protection. We've been talking about the importance of health protection, social protection, but also access to water and sanitation and hygiene, and the important role of these rights to realize the right to health, water, sanitation, social security, and adequate standard of living. Second, we've also been talking about prevention and preparedness, as Anushka has already has just highlighted on from the other panel. Really the need to build and reinforce the health and social protection systems and ensure quality public services. So it's really making sure that we have systems in place that can react better, that to address the inequalities and the inequities that we have seen so much exposed through the COVID crisis. Make sure that we have systems in place which are inclusive of all, and making especially sure that they reach those most left behind. And really making sure that we reinforce and build solid social protection systems, and in particular solid social protection floors, which can really guarantee at least a right to a basic level of income security and access to healthcare for all. I think this is really essential for countries to be more resilient and better prepared. My third P is partnerships and promotion, so it's even 2 Ps. And we know that there are a lot of political commitments in these areas already, but we also see that there is really a gap when it comes to effective implementation. And so now it's really the time to go back to these commitments and really put them into practice, and especially making sure that we can achieve the SDG agenda on which we have fallen back so badly. My fourth piece is the public financing. We've been talking a lot about the need to ensure the necessary financial resources and necessary fiscal resources, making sure that the necessary investments are being done, and ensure that these financing structures are not only sustainable, but they are also equitable and are based on solidarity in financing, both at the national level and at the global level. And my fifth point, P, is simply to say, well, it's possible. We can actually do it. I mean, we know what we need to do, but now it's a time really to make the necessary changes to put that into action. Thank you.
Great. Thank you so much, Christina. And lastly, Justin Kunin, it is great to see you again. Please tell us about the session you just facilitated.
Thank you so much. So our session was around multi-stakeholder engagement, the promises and the challenges. And the context was really an acknowledgement that around the globe, COVID has laid bare existing inequities in housing, in health, in economics, in education, in food systems. The virus has exploited these vulnerabilities to further ravage already under-resourced communities. And I thank Osiris Barbo, former Commissioner of Health in the City of New York, for that wonderful description of what has happened. And against this context, there was really quite a remarkable positivity among participants. 90% of our participants said that multi-stakeholder initiatives to address these challenges work. We heard from government that although there were challenges, we got to where we needed to go. We heard from young people, from Evelyn Courageau, who said, yes, we were actually heard in this process. We heard from the private sector that we've created mechanisms so that there is independence of private sector action. Now, the question I think there is that a bit of a surprise? Because we know that there are challenges in doing this kind of multi-stakeholder work. These processes, as we heard from Jan-Willem Chegron, can be slow, they can be complex, they sometimes don't deliver. Civil society can be tokenized in their involvement. We know that there are sometimes conflicts of interest in the involvement of the private sector, that there's intransigence in government bureaucracies. So what's happened, and I think the realization among our panelists and our participants, was that the crucible of this crisis has forced us to work together, that the COVID-19 crisis has taught us that the government needs the community as much as the community needs government, indeed that we all need each other. And so the key question then becomes, how do we keep this momentum, translating it towards UHC and the Sustainable Development Goals for 2030 once the crisis is over? Our partnerships during COVID-19 have demonstrated what is possible, but now we need to ask what barriers, what bureaucracies can be removed as we move forward. We're in a transformative period, and that's a period of tremendous potential. We can take lessons from a previous pandemic, the HIV/AIDS pandemic, that not all multi-stakeholder partnerships endure. And so the question really is, how can we create the institutional commitment for these changes? How do we create the bench depth in institutions? Because it's easy for those systems to default into ways they've traditionally functioned. How do we institutionalize the changes that we've seen? How do we institutionalize social participation and social accountability? And these are questions that WHO and many partners are attempting to answer in the Handbook for Social Participation on Universal Health Coverage. And I'll end with a plug. It's launching next Tuesday. Stay tuned. Thank you so much.
Thank you very much, Justine. And just a recap on the poll results, we asked you which session you attended out of the 4 breakout session, and 37% of you attended session 1, 21% session 2, 26 session C, that is section 3, and 16% attended the breakout session number 4 on strengthening multi-stakeholder platforms. Wow. Thank you so much, everyone, for making these discussions during the breakout session so meaningful and rich. And I know it was impossible to be in all 4 rooms, but the good news is every single minute of this summit is being recorded and will be up on the website. So you can always go back and listen in where you missed and, reflect on the discussions that went on. And although the breakout sessions have ended, the discussion has not. So let's keep the ideas, thoughts, reflections going in on the chat and on social media. Our 4 hashtags, hashtag Lives in the Balance, hashtag UHC, hashtag COVID Call to Action, and hashtag Health for All. Now, in our previous sessions, we've heard from you, from our guests and speakers, that recovering and moving past COVID-19 will require not only strong political leadership, but it will also require meaningful engagement and collaboration. And this came out strongly in the last Lives in the Balance Summit that was held in July, that we need power of partnership and collaboration to ensure, we move together, and even as we strive for universal health coverage. Now, the WHO has pioneered the efforts for UHC and has been leading the fight against COVID-19. And today, on the eve of UHC Day, we are delighted to hear from Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, who will speak to the importance of leadership, global solidarity, and collaboration as we move into a new year with new hope. Welcome, Dr. Tedros.
Excellencies, dear colleagues and friends, as you have heard throughout this summit, the impact of the COVID-19 pandemic goes far beyond the disease itself. It affects nearly every aspect of economic, social, and health systems. Women, children, and adolescents bear a disproportionate burden on many fronts. Dozens of countries are at risk of running out of contraceptives and maternal health supplies. An estimated 6.7 million additional children face severe hunger this year. And while there is cause for optimism, We know that the ripple effects of the pandemic will continue to be felt long after the rollout of a vaccine. The pandemic has shown why investments in health are the essential underpinning of social, economic, and political stability. Political will, leadership, and sustained investment in all countries are more important than ever for building strong primary health care as foundation of universal health coverage. I am heartened by the leadership on display at this summit, particularly the commitments announced today in response to the PMNCH call to action on COVID-19. There are important commitments to protect services and ensure that COVID-19 plans are not gender blind. They're also important for giving women and young people a seat at the table and for enabling civil society to engage with and hold governments to account. These commitments underscore that protecting the world from global health threats and protecting the progress of past decades on women's, children's, and adolescents' health are not competing agendas. They're fundamentally linked. WHO is proud to host the Partnership for Maternal, Newborn, and Child Health and UHC 2030. Thank you to these organizations, the core group, and the many other summit partners for convening today's meeting. I particularly want to acknowledge 3 women who stand up tirelessly for the health of women, children, and adolescents, and for universal health coverage. The Right Honourable Helen Clark, the former Prime Minister of New Zealand and current PMNCH Chair and IPPR Co-Chair, Dr. Gro Harlem Brundtland, the former Prime Minister of Norway, Co-Chair of the Global Preparedness Monitoring Board, and one of my esteemed predecessors at WHO, and Ms. Graça Machel, whose titles and contributions are too many to name. And to our many youth leaders, including our next speaker, Daniele, I'm committed to working with you to bring about the kind of systemic and sustainable change that you're calling for and that you so rightly deserve. Thank you all, and see you at the next Lives in the Balance Summit in May.
Always insightful to hear from you, Dr. Tedros. Thank you for those important words and for highlighting the need to stay focused and on the ripple effects of COVID-19, even as we begin to emerge from this pandemic. Now, ladies and gentlemen, our next guest who joins us from Jamaica is an inspiring, multidimensional young leader with interests including digital technology and the arts. Danielle Mullins from Tech for Health and Transform Health. Welcome to this virtual stage. It is a pleasure to have you with us, Danielle.
Thank you so much for having me, Mercy.
Oh, great. And you look great. All right. So let me just pick your mind on something, Danielle. We've heard so much about, COVID-19 and the ripple effects it's having on women, children, and adolescents and youth like you. What has been your own personal experience of COVID?
Of course. So, COVID-19 is much more than just a healthcare issue. It has effectively, it's affected every section of society, looking at social, economic, everything really. I think for young people, including myself, one major sense of loss that we feel is that you're no longer at school or university or those, maybe it's church, whatever those typical places that you would engage in, you no longer have access to them. And at first you may say, well, that's just an education problem, but it's not. It's more than that. It goes back to healthcare as well. You're looking at, you can no longer access the guidance counselor maybe, or maybe those who will be accessing the doctor or the nurse or whomever else it may be within the school space. The school was a safe space for many young persons. And I think that effect has been very tangible.
Right. And I think and I'm certain that, millions of young people share the same experience that you just explained. Like it's something that cuts across, whether you're in Jamaica, whether you're in America, whether you are in Kenya or Afghanistan, wherever it is, the challenges are almost similar for young people. Now, when you come to the techie side of things, is there a way that technology is helping young people to navigate these challenges?
So definitely, you're going to look at an increase in telemedicine or teleservices there. And what I'm seeing is, typically the doctor model will be, you go into the doctor and, tell them your problems and then they'll tell you what to do. But there's also a change to, I suppose, maybe a little bit more autonomy in that sense, in that, no, you're Googling what is the issue, or, you're searching for information in that sense. And so I think the model that would be very effective for us to move to is where, as easily as I can access, the latest news on social media or so on, I should be able to access accurate and reliable healthcare information just as easily as I'm accessing the latest trends on this or that social media platform. I would also say I've worked with UNICEF's U-Report Youth Council, and last year when we had a dengue outbreak, we used it to quickly poll about 10,000 young persons across the island to identify what area of dengue is it that you don't really understand or would need more information about. And then we worked with the Ministry of Health then to get accurate information and then disseminate. So there's that role of technology in allowing us to collect data from young persons quickly and also effectively disseminate it.
Wow, wonderful. Thank you very much for that. And we could speak, going forward, we could talk about this, but I just want to pick your mind on one last thing. Now we have hundreds of partners watching this summit from around the world. Governments are listening in, the civil society, financial institutions, and all these, people who we feel are decision makers. What is your message for them?
My message is this. I've seen us, develop a COVID-19 vaccine in less than a year, right? Maybe not be finished, but we're very much on track to developing it. And, I have to ask myself, would this have been the same if COVID-19 didn't disproportionately affect, the older generation? What if it were a disease that was, only affecting the younger or more marginalized populations alone? What we're seeing is immense economic investment and political willpower, to solve this disease. And so I have to, say to the global digital health community, or the global health community overall, what are your priorities? What are the diseases that you choose to solve? Like who do they affect? And why? Why is it basically? How do you prioritize what disease gets solved and what doesn't? There are many diseases that disproportionately affect young people and have been with us for ages. A disproportionate affect not just youth, but also women or other marginalized populations. I have to ask us to remember our power and remember, why it is that we're doing what we do. I also want to encourage us, all governments, to start to include young people and give them a seat at the table. When you're developing health strategies, it affects everybody, across your entire population. Whose voice is not being heard at the tables that you sit at? And I think that's a question for every leader to really consider. Whose voice is not being heard here? And for all youth leaders that may be watching this, you may be working on your own projects in your own communities. I want to continue to encourage you to do that. Because as we mobilize these different pockets, these different smaller communities, we're effectively mobilizing the world towards a greater good with healthcare for all.
Wow, beautiful, Danielle. So good to hear from you. And yes, give young people a seat at the table. I think those are words that resonate, for very many young people out there, including me. Now, we are nearing the end of this summit, and I do not think I am ready to let you guys go, but it is well, we will keep these conversations going, like I said, on social media, in our social circles, offices, homes, and everywhere else, because everybody needs to hear about the important discussions we're having today. Now, I have one quick poll for you, probably the last poll, and we're asking, what did you like about this event? Tell us, give us, your feedback, let us know what you felt, what came out strongly for you, and we will really, really value, and we have valued your participation so far. At this point, I would like to call to the screen our three co-hosts to say a few words. So welcome the powerful, phenomenal women, Helga Fogston, who's the PMNCH Executive Director, Agnes Sukat, Director for Health System Governance Financing at the WHO, and Lisa Helmy, Executive Director of Co-Group and Chair of the PMNCH NGA constituency. Welcome, ladies, and yes, let's hear what you have for us.
Thanks, Danielle, and thank you, Mercy, for your passion, and thanks for doing such a great job, as always, in moderating the summit and keeping us grounded. Thank you also to Nazim and Abelone for their powerful voices and even more powerful words. As we come to the end of the summit, I would like us all to take a moment to reflect about everything we've heard today and think about one thing that really stood out. I'd like your thoughts on this, Lisa and Agnes. And of course, everyone else, please share your thoughts with us in the chat box. Agnes, what do you think?
Well, Helga, I think you know already what my answer is going to be. The one issue that stood out for me today is not necessarily a new one, and in fact speaks to the objective of today's summit. What we know, what is crystal clear, is universal health coverage cannot be achieved without realizing women's, children's, and adolescents' health and rights. But there is the other side of the coin, and that's why it is so important to link the two agendas of universal health coverage and the health of women, children, and adolescents, is that women, children, and adolescent health and rights cannot be achieved without realizing universal health coverage. So it goes really both ways. And it is precisely during these challenging times, such as those that we are living now through the COVID-19 pandemic, that we must enhance our efforts to improve the both sides of the coin. Really, these rights of women, children, and adolescents, and on the other hand, this access to universal health coverage, it is one and the same agenda.
And for me, I think it has to be the call to action that we heard from Danielle, to not forget young people. We know that adolescents and youth are not only for our future, but they're here for our present too. And we really need to work with them to promote their well-being, including through the use of digital technology. Helga, what about you?
Well, from my perspective, while there was many issues that stood out, such as the need for political commitment and accountability, the need for targeted investment in social protection schemes that actually reach women, children, and adolescents, the need for innovation to leapfrog bottlenecks and size opportunities for effective investment. The comment that Tedros made resonates also with us, the power of partnership, that coming together, moving the needle on an issue that has been highlighted today in our call to action, if we act together rather than on our own. However, I must admit, my favorite was my former Prime Minister's wise advice to us all. Show your passion, use your voice, and speak out with courage. I think that's something we should take with us to heart. COVID-19 has threatened everything we hold dear, but it isn't the first adversary we have faced as a community, and it won't be the last. We will get through this as long as we speak with one voice and walk in true partnership. It's been heartening to see that over $20 billion in commitments that governments and donors have announced during this summit. This wouldn't have been possible if we as a community had not kept our finger on the pulse through these 9 months, insisting on that UHC deliver for women, children, and adolescent health, and that we are the center in national COVID response. But we have still a long road ahead of us to mobilize not only other countries, but partners from all constituencies to play their unique part in this collaboration that not only builds back better, but builds forward more powerfully. So let's keep the momentum going and regroup once again in May 2021 at our next Lives in the Balance Summit to assess where we are and where we need to go. But before I hand over to you, Lisa, I would like to thank the core group and UHC 2030 and all other contributing partners for co-hosting the summit with us. I must say today that I felt while we are taking small steps in the next right direction, so very quickly, I'd like you all to humor me. This is something we at PMNCH do when we achieve achievements. We do one clap, and I would like my co-hosts here to join me in being able to, celebrate this moment and put our spirits in order to move forward better. So, are you with me, Lisa and Agnes? Okay, let's go. I'm going to count to 3. 1, 2, 3. Lisa, over to you.
Thank you. That's great. Thanks a lot for that, Helga. It has been quite a year for everyone. And I think you're right. We have a long way to go, but I really find these community gatherings, they're very energizing. They remind me of how our community, we're challenging the status quo of things because we really, really want women, children, and adolescents everywhere to survive, to thrive, and to transform, no matter what the challenge is. I look forward to reconvening for the next Lives in the Balance in May 2021. And we know that 2021 will be a better year. However, before May, I want to let you know about another opportunity that will be fantastic. And this is happening just next month when people come back rejuvenated from the holidays. We will be continuing the dialogue, the action at the Global Health Practitioner Conference that Core Group and many other partners are hosting on 27th and 28th of January, 2021. We've been organizing this conference for over 2 decades, and for the next conference, it's especially relevant. Prioritizing child and adolescent health and well-being in the new decade. And what are the objectives? So we want to strengthen commitment to child and adolescent health and empower young people to advocate for their rights. 2, mobilize and strengthen those cross-sectoral partnerships and innovation for child and adolescent health. And 3, share evidence-based research, data, and emerging solutions. And the practitioner conferences, they're usually focused on skill building sessions, encouraging dialogue around child and adolescent health and well-being. And in our current times, both of these are really needed more than ever. So everyone is invited, and please do join us to learn about the latest research, the trends, and some of the technical innovations. Details about the conference should be now being added as I speak in the chat box, and it will be free to everyone with International Sign Language, French, and Spanish interpretation. I'd just like to thank everyone today for the rich, very meaningful discussions, and I hope all of you and your families remain safe as we close out 2020. Anye, over to you.
Thank you. Thanks both. Women, children, and adolescents account for 2/3 of the world population. So if we are serious about leaving no one behind on the road to universal health coverage, we need to continue with our efforts and dialogue. If we need to go away today with one simple message, it is let's join hands and unite to call on our political leaders to invest in health systems that protect everyone now. And this starts with stronger primary health care. But even before that, it really starts with investing in common goods for health, the step 0 of universal health coverage funding. Systems that protect everyone are systems that fund public goods and redress the failures of the market. And common goods are for everyone because they cannot be divided. Nobody can be excluded. Nobody can buy them other than the collective purse. So common goods are by essence the first step of equity, the step 0 of universal health coverage. And that's why we need to join hands, unite, to foster collective action. And that collective action needs to be fully inclusive of the most vulnerable, of the poorest, and of course, within that, of women, adolescents, and children. We also need to invest in human resources for health and infrastructure. We still have too many countries who are left behind, in which people don't even have access to the most basic services. And for those, we really need to invest in scaling up the workforce, a workforce that will serve women, children, and adolescents, a workforce that is, we know, mostly female, and is right now the group that is suffering the most from the impact of this pandemic, the health workers who are the front line, and particularly the women at the front line. So investing in the foundations of health system who are health workers and basic infrastructure through a PHC approach is really the second step of investments in health system. As we head into UHC Day tomorrow, I really urge everyone to use the opportunity to highlight the issues that we've heard today and to demand health for all from your governments, because the lives, livelihoods, and future of millions of women, children, and adolescents depend on it. Tomorrow, we are organizing a 24 hours Protect Everyone virtual rally. You will find more information about the rally in the chat box in a minute. Let's get as many people as possible. Get your friends, your family, your colleagues involved, especially now that COVID-19 has made the fight for health for all personal for just about everyone. Who wants to be infected with COVID-19 and have no access to services? On this note, as we close the summit, Helga, Lisa, and I want to thank you for your time and leave you with a message that we hope you will join us in spreading tomorrow. Helga, Lisa, ready? I support health for all.
We must protect
everyone.
Thank you.
Thank you.
Wow, wonderful. I also support Health for All, and we must protect everyone. Thank you so much, Helga, Ines, and Lisa. It is a pleasure to see, you three phenomenal women leading together like this. And this is a true illustration of the power of partnership. Now, as you've just heard, now more than ever, we need to come together in solidarity, gather momentum, and demand for the change that we need and so rightly deserve. And as we prepare to close our event today, I want to bring to your attention the polling question that has popped onto your screen and which came on earlier. Please take some time to provide some feedback on this event. We are looking forward to hearing from you. And now, our last appearance of the day here is Abelone, who we met earlier during the program, inspiring us as we prepare to take charge and make a difference for women, children, and adolescents. Abelone.
Thank you so much. What gives us a meaningful and a happy life is when we're there for the people who needs our help. Yeah. It's not always about myself. It ain't always about myself. It ain't about that new belt from Dior, or that order more. Take a trip to the mall, buy some good food just to have a ball. Possession that don't make me rich. Possession that stuff make me sick, cause what makes us rich is giving our heart, caring, giving our hands, saving. It's not about me, it's not about you, it's all about us. Why can't we see how life could be so simple and sweet? Then our life could be all complete. When we see someone's down, we should lift him up. Can't save everybody, but we can save one. Let's stand together forever. Let's stand to make the world better. Forever. Oh yeah. Happy, happy. Let's make one happy. Like birthday happy. Oh yeah. Happy, happy. If we make one happy, What gives me life is seeing others happy. A smile on everybody's face, I want it so badly. When we stand together, the future will be bright. Our relationship with each other will be much tighter. It's time to make a change with a new generation. Helping one's life be no higher education. With the right mind, we'll make a good foundation. With a good foundation, it'll build our nations. You might come from east, I might come from west, but when we save a life, that's when we all are blessed. Let's not have time to focus on the negative. Let's not hate on each other, but love on like it's a relative. Cause when we see someone's down, we should lift him up. Can't save everybody, but we can save one. Let's stand together, forever. Let's stand to make the world better, forever. Oh yeah, happy, happy. Let's make one happy, like birthday happy. Oh yeah, happy, happy. If we make one happy, then we're all happy. Yeah. Let's make one happy. Let's make one happy. Oh, yeah, happy, happy. Let's make one happy, like birthday happy. Oh yeah, happy, happy. If we make one happy, then we're all happy. Yeah.
Oh, Melanie, that was brilliant. You sing so beautifully, and thank you once again for being here with us. And ladies and gentlemen, that marks the last performance of this summit, and just expressing, our sincere gratitude to you all, our participants, the audience. We are honored that you chose to spend the last 3 hours with us. And we hope to mark tomorrow's UHC Day 2020 with renewed commitment, inspiration, and motivation, for collective and meaningful action for women, children, and adolescent health, and for UHC. Let us all protect the progress, protect everyone. This is the only way we can build back better. As we look forward to connecting again at the next summit being planned for 2021. Our deepest gratitude to the co-hosts, PMNCH, Core Group, and UHC 2030, together with all the amazing partners who came on board to make this event a success. Have a safe and wonderful holiday season, and may this new year bring us strength, hope, and change for the better. Bye-bye.
Yes, we can. Together, one world, we will succeed and overcome. To all the doctors and all the nurses, saying thank you. We will never forget you. We will never forget you. To all the doctors and all the nurses, and we will conquer. We will never forget you.